You go to bed feeling normal. You wake up, test, and the number punches you in the face. High fasting glucose out of nowhere. Then your A1C comes back fine, like nothing is wrong. That contradiction makes you doubt everything you ate, everything you did, even the meter. But most of the time, this is not random and it is not you failing. It is a specific pattern hiding in plain sight, and 2 mornings that look identical can mean totally different things. Moving to slide 2. A high morning reading can come from 2 very different mornings. One is true fasting. Your glucose is already elevated overnight, and it stays elevated into the morning. In that case, the bedtime number matters because it reflects where you are spending a big chunk of the night. The other is a dawn rise. You go to bed decent, you run steady for hours, then glucose lifts in the early morning window. Here, the same bedtime number can be misleading because the problem is timing, not the whole night. To tell them apart, you need one extra data point. If you have a CGM, look for a climb between about 3 a.m. and wake up. If you do finger sticks, do a few spot checks. Bedtime, once around 3 a.m. for a couple nights, and then immediately on waking. True fasting often calls for a medical plan. A dawn rise usually calls for habit changes because your liver wakes up first. Moving to slide 3. Before you open your eyes, your liver is already at work. In the early morning, hormones shift. Cortisol trends higher, and that can nudge your liver to release more glucose. Growth hormone also rises during the night and can temporarily make your tissues less responsive to insulin. Meanwhile, your muscles are still inactive, so they are not pulling much glucose out of the blood. If you are under stress, sleeping poorly, or training hard without enough recovery, that whole hormone mix tends to get louder and the dawn rise gets easier to trigger. What you do with this is simple. First, confirm the timing so you are not guessing. Then, on nights before high mornings, look for the pattern. Late workouts, stressful evenings, short sleep, or big late meals. If you can, add a 10 to 20 minute easy walk after dinner, and keep the last hour before bed calmer and darker. You are not fighting breakfast. You are managing what happens before sunrise without falling into the rebound myth trap. Moving to slide 4. A lot of people get told high morning glucose means you went low overnight and rebounded. For most adults, that is rare. A true rebound requires a real overnight dip, and many fingersticks never catch it, but CGM trace can. If you treat a dawn rise like rebound by adding extra bedtime carbs, you can drive the whole night higher and make mornings worse. Don't feed a problem you never proved. Moving to slide 5. If dinner is big and late, you can still be absorbing glucose while you sleep. High-fat meals slow gastric emptying, so carbs show up in the blood later than you expect. Alcohol can also disrupt your liver's glucose control overnight, especially when it stacks on a heavy meal. Restaurant portions hide carbs in sauces, breading, and sides, even when the plate looks healthy. The move is boring and effective. Eat earlier when you can. Tighten portions at dinner. Go lighter on fat-heavy add-ons, and take a short walk after the meal. Better sleep often starts with better glucose before bed, because sleep loss spikes fasting. Moving to slide 6. If your fasting glucose is higher after a bad night, it's not in your head. Short sleep pushes stress hormones up, especially cortisol, and that signals your liver to release more glucose before you even eat. Then the next day, your muscles respond a little worse to insulin, so the same amount of glucose stays in the blood longer. REM matters too. When REM gets chopped up, a common pattern is higher morning readings, even if total sleep time looks decent. Pay attention to why the sleep was bad. If you wake up with a dry mouth, morning headache, or your partner says you snore or stop breathing, sleep apnea is a big red flag. Apnea can create repeated adrenaline surges all night, and that can make morning highs feel stubborn. What you do tonight is simple. Protect a consistent bedtime. Keep the room cool and dark, and avoid alcohol close to bed, since it fragments sleep. When you see the number, remember it might be a sleep signal first, not a breakfast problem. Stress can look exactly like carbs. Moving to slide 7. You can wake up anxious, eat nothing, and still watch glucose climb. That is your body choosing fuel for a perceived threat. Work pressure, a tense meeting, even scrolling bad news can raise cortisol and adrenaline, which tells the liver to put more glucose into circulation so you can move, think, and respond fast. Training can do the same thing. A hard session is fine, but stacking high-intensity days, under-eating, and sleeping poorly can push your baseline stress higher. Then you see elevated fasting or a higher-than-expected reading after a normal meal. Pain and inflammation count too. A flare of back pain, an injury, even a brewing infection can nudge glucose up because the immune response is energy expensive. Action steps. Match training intensity to recovery. Add a true low-stress day. Try a 10-minute walk after meals and a 2-minute slow breathing drill before testing, because you are measuring your state, not your willpower. And if the spike appeared suddenly, do not ignore what changed in your life or in your medicine cabinet. Moving to slide 8. Some glucose spikes are pharmacy-driven. Steroids are the classic example, whether it is prednisone pills, steroid shots for joints, or high-dose inhaled steroids. They can raise glucose for days because they increase insulin resistance and push the liver to release more glucose. Decongestants are another common surprise. Products with pseudoephedrine or phenylephrine can raise heart rate and stress signaling, and that may elevate readings in some people, especially if you are already borderline. Some antidepressants and antipsychotics can shift weight, appetite, and insulin sensitivity over time, and a few can raise glucose more directly. Hormonal therapies can also move the needle, including testosterone changes, some birth control formulations, and menopause-related therapy, depending on the person. Your move is not to panic or stop meds on your own. Log the name, dose, and timing, and note when the glucose changed. Then bring that exact pattern to your clinician or pharmacist and ask, is this expected? And is there an alternative or a different schedule? Sometimes the number is revealing risk you did not know you had. Moving to slide 9. It is possible to be early prediabetic even with a normal A1C. A1C is an average, so it can miss big spikes and dips. In early insulin resistance, fasting glucose often drifts up first, especially with family history or more waste fat around the organs. If your morning numbers are repeatedly high, treat it as useful information, not a verdict. Tight measurement and good context make the next decision clear. Moving to slide 10. Before you trust a reading, make sure you measured correctly. Wash and dry your hands. Fruit residue, sugary drinks, or even some lotions can contaminate the fingertip and fake a spike. Use strips that are not expired and store them sealed away from heat and humidity. Rest before you test. If you just climbed stairs, argued, or rushed out the door, wait 10 to 15 minutes and sit quietly. If the number still looks wrong, repeat once with a new strip, ideally from a different finger. And keep notes on time, sleep, stress, and any meds, because patterns beat single data points. When you measure cleanly, you stop chasing ghosts, and you start responding to the real signal, not the quick fix that only looks good for a moment. Moving to slide 11. A lot of fast fixes look smart, then quietly push your morning glucose higher. Skipping dinner can raise cortisol overnight, and that can nudge glucose up by morning even if you ate less. Extreme fasting can also increase liver glucose output, so the number rises while you feel like you are doing everything right. Hard cardio first thing, especially before food, can spike stress hormones and bump glucose short-term. Keto flu can mask the real pattern because sleep, hydration, and electrolytes are all shifting at once. And the biggest trap is changing 5 things in 1 week. You cannot tell what helped, what hurt, or what was just noise. If your goal is better mornings, the win is stability, not intensity. Make it boring enough that the data can talk. Moving to slide 12. Here is a simple debug plan. For 2 weeks, take a bedtime reading and a wake reading. Write down dinner time and what it was, especially carbs, alcohol, and dessert. Score your sleep quality each day, even just 1 to 5. Add a quick note on stress and training, like hard lift, long run, or rest. 2 weeks of clean notes beats confident guesses every time. Moving to slide 13. Get help if you repeatedly see fasting numbers above 125 on more than one morning. Also, take symptoms seriously, like unusual thirst, frequent urination, or unexplained weight loss. If you are pregnant, tighter targets matter, so bring your logs to your clinician sooner rather than later. Ask whether a short CGM trial makes sense, because it can reveal overnight patterns you cannot catch with one reading. If this helped, subscribe for more practical health breakdowns. And comment with your typical weight glucose range and what time you eat dinner. Medical disclaimer: this video is educational and not medical advice. Talk to a qualified clinician for diagnosis or treatment. Ketosis is a tool. Metabolic flexibility is the goal.